Okay, Katarina. Congratulations on your recent graduation.
Thank
Tell
you.
us a bit about yourself.
Yeah, so Oki in the Danago, just Tsii'sti'koo'miniyaakii. In English, my English name is Katarina Chief Moon Riley. So I have just recently graduated from University of Saskatchewan with a Doctor of Medicine. It's been a huge achievement. All my life I wanted to be a doctor since I was young, as far as I can remember. I think as a toddler, I always had a play stethoscope. I'd always kind of bandage my parents. So from a young age, I knew I wanted to be a doctor. What further motivated me to pursue medicine was my grandma, my late grandma, Mildred Chief Moon. She was quite sick from a young age, and so I always wanted to learn more about her health conditions so that I can help her more, and as well as help others in the community. That was always my main goal, is to come back and practice in Kainai. So like I mentioned, I just finished my MD degree. I'm starting residency now. I'm doing residency out of University of Calgary's rural program. So I'll be based out of Medicine Hat. So I do, my core rotations there, but as well as I'm doing a rural medicine rotation here on the reserve for 2 months. So I'm really looking forward to that. I'm hoping to be working both with Dr. Christensen and Dr. Tailfeathers. So that's kind of, the next few years, what I have planned for myself. So prior to my medical degree, I also did my undergrad at the University of Lethbridge in neuroscience. After that, I also did my master's. I did a combined degree in neuroscience as well as health science, where my thesis was focused on the biological impacts of residential schooling. So for me, that was something that was really important because I guess I didn't introduce my family, my parents, but my grandparents, the late Mildred Chief Moon as well as John Chief Moon, both attended residential schools, and I could see how it had impacted them. They didn't really talk about it, but we all knew what had happened at residential school, but I felt like there wasn't actually biological data of the impacts that these residential school survivors have endured. And so that was something that was really important to me, and that project was very near and dear to my heart. And my findings did find that individuals who had a mother attend residential school were about 12 times more likely to be physically impacted. And so how we measured that was through allostatic load. And so essentially that is a theory based on the wear and tear of the body due to repeated exposure to stress. And so normally when we endure stress, our body, goes into fight or flight. And then after that stress is gone in the environment, our body should go back to normal. But when you're constantly exposed to stressors such as physical abuse, emotional abuse, or sexual abuse, this can cause your body to dysregulate, and then your body is releasing high amounts of cortisol, and that can really impact people's health. So my findings really, I guess, confirmed what we all knew about residential school. So again, that was a project I was really proud of and very near and dear to my heart. I've been a Gipodapaga all my life, so I was kind of raised by my grandparents as well as my mom, Gloria Chief Moon, and so they have been a really huge part of my life, and they instilled the importance of education from a young age, but as well as the importance of our Blackfoot traditions and culture, and that's a huge part of my identity, and without them I wouldn't have been where I am. So I'm super thankful for how they raised me and how they balance the importance of Western knowledge as well as my Indigenous perspective.
Okay.
So, yeah, that's a little bit about myself.
So I'd like to talk to you a little bit more about your study and your thesis, maybe in a further interview. But for now, it's very timely as well with the missing children being discovered and so forth. And of course, we hear news this morning of more.
Yeah, in Saskatchewan.
So just, in having immersed yourself in the study of the effects, the historical trauma, the ripple effects from residential schools. What are your thoughts on these children being found?
Yeah, well, I think unfortunately people, from First Nations community knew that was the reality, and I think a lot of Canadians, non-Indigenous populations, were still hesitant to believe that residential schools were that terrible. I think a lot of times people still have that mentality of like, oh, get over it. It happened a long time ago. But I think, as unfortunate as that news is, it is opening a lot of people's eyes and realizing, the trauma that First Nations and Indigenous populations in Canada have endured. And that it wasn't as long ago as they like to believe. The last schools closed in the 90s. And so I think it's, unfortunately, it's creating that dialogue that's needed and towards working towards reconciliation. So I think, and it's an unfortunate history, but I think it's starting to move people in the right direction to have that dialogue in terms of how can we all just come together and not have that rift between Indigenous populations and, the non-Indigenous populations as well as government. So I'm hoping, it helps move us towards reconciliation.
Any last comments on this awesome achievement and, where do you go from here, and maybe some words of encouragement for your other colleagues?
Yeah, so after residency, because Family Med is a 2-year program, and so you do have opportunities to do other enhanced skills is how they refer to it. So you can do like geriatrics, which is just focusing on elderly populations. You can do anesthesiology, emergency, as well as surgery. And so I want to do a year of surgery so that I can do simple procedures such as like colonoscopies, appendectomies, so that's removal of the appendix, removal of the gallbladder. So I really hope that I could, pursue that extra year of training and then come back and utilize those skills on the reserve, because I think our community definitely would benefit from a surgeon, especially being able to deliver babies and doing low-risk C-sections is something I think would be very beneficial for our community. So that's something else I really want to pursue and really come back to the community. In terms of words of encouragement, I think, it's very important that we get more Indigenous doctors, especially ones that want to come back and help the communities. I think, especially female Indigenous doctors are very high in need. And, even if it's not even a doctor, like we need more nurses, we need more even lab techs, like just more people in the healthcare in general. So I think, anyone thinking about it, I think just go and pursue it, don't hold yourself back. I think there's a lot of people that are really starting to pursue their goals, and it's really awesome to see that. And I just want to keep motivating others. I'm always here if people want, advice. I always try and mentor as many people as I can and just encourage the youth to, pursue their dreams. And, it's going to be a tough road. It's going to be hard work, but it will definitely it will pay off, and it's definitely worth it. It's very rewarding.
Well, I look forward to speaking with you further.
Yeah.
But in the meantime, congratulations.
Thank you.
Thank you.
Yes, awesome.